there, viewers! Do you experience widespread pain throughout your body that affects your energy, mood, and sleep? You may be suffering from a medical disorder called fibromyalgia. To learn more about fibromyalgia and to learn about some of the things that you can do to improve your quality of life, keep watching. Real quick, don't forget to like, subscribe, and comment below. Some medical conditions are easy to diagnose because you can see them on an imaging study. For instance, your doctor can easily diagnose pneumonia by seeing the infection on a chest x-ray. However, not all medical conditions can be visualized or found on a lab test, and this can make their diagnosis very tricky. Fibromyalgia is a medical condition that fits into this category. It's a diagnosis of exclusion, which means that other diseases have to be ruled out first before you can be diagnosed with fibromyalgia. Researchers believe that fibromyalgia is caused by repeated nerve stimulation in the brain that results in an abnormal increase of chemicals in the brain that signal pain. This increase in chemicals causes the brain and spinal cord to change. As a result, the brain's pain receptors start to overreact to both painful and non-painful stimuli. In many patients, the symptoms of fibromyalgia start after a triggering event. Common triggers include a physically traumatic event such as a car accident, certain infections, surgical procedures, or psychological stress. Some people have an increased risk of developing fibromyalgia. Gender appears to play a role, as fibromyalgia tends to affect women more than men. You are also more likely to develop fibromyalgia if you have an immediate family member with fibromyalgia. So family history and genetics may also be a risk factor. Lastly, fibromyalgia tends to coexist with other medical conditions. So for example, if you have chronic fatigue syndrome, migraines, irritable bowel syndrome, lupus, or rheumatoid arthritis, you may be at increased risk of developing fibromyalgia. The main symptoms of fibromyalgia include constant dull, achy pain, fatigue, and difficulty concentrating. The pain associated with fibromyalgia is characterized as overwhelming, widespread pain, which means that it occurs on both the right and left side of the body and involves the regions above and below the waist. Fibromyalgia also makes the skin very sensitive to touch. This makes it difficult to be in crowded places because people with fibromyalgia may experience intense pain if someone brushes up against them. The fatigue that results from fibromyalgia affects people regardless of how long they have slept. People who have fibromyalgia often wake up from sleep due to pain as well, which also contributes to the constant fatigue. Fibrofog is a term that describes the cognitive difficulties suffered by people with fibromyalgia. Fibromyalgia causes difficulty with concentration and impairs a person's ability to focus. In particular, short-term recall tends to be affected, making it difficult to remember recent information or events. To meet the criteria for a diagnosis of fibromyalgia, you must have had at least 3 months of widespread pain throughout your body. If you think you may have fibromyalgia, your doctor may refer you to a rheumatologist, who will likely order several tests to rule out other medical conditions that can have similar symptoms. You may also be referred for a sleep study. There is no cure for fibromyalgia, and it can be very difficult to treat. Treatment often involves using a combination of lifestyle modification strategies in addition to medication, with the goal of minimizing symptoms and improving overall well-being. Several self-care strategies have been found helpful in the treatment of fibromyalgia. Stress management. It is important to find ways to avoid stressful situations. Focus on relaxation techniques and try to develop a routine that will give you a predictable and less stressful lifestyle. Learn how to say no to situations that will increase your stress level and allow yourself time each day to unwind and relax. Regular exercise. Regular exercise has been found helpful in decreasing the symptoms of fibromyalgia. At first, exercise may increase fibromyalgia pain, but over time, regular, low-impact exercise will help to decrease symptoms. Examples include walking, biking, and swimming. Stretching and good posture can also be very helpful. Healthy diet and lifestyle. Try your best to eat fresh, unprocessed foods that are full of vitamins and minerals, and avoid alcohol, smoking, and other tobacco products to maintain a healthy lifestyle. Regular sleep schedule. Try to establish good sleep hygiene to improve your quality of sleep and reduce fatigue. This includes creating a sleep schedule to go to bed and wake up at the same time each day, and limiting naps throughout the day so that you can get to sleep at night. Avoid overexertion. It can be tempting to overexert yourself when you are feeling well, but doing so will likely result in feeling worse on your days when you are feeling off. Try to moderate your activity so that your energy level is stable. This means avoiding too much activity on the days that you are feeling well, and continuing to do some activity on the days when you are having symptoms. Medications can also reduce the symptoms of fibromyalgia. Some of these medications include over-the-counter pain relievers, such as Tylenol, ibuprofen, and naproxen. Other helpful medications include antidepressants and muscle relaxers, which can help ease fatigue and pain as well as promote sleep. Certain anti-seizure medications can also be effective in reducing fibromyalgia symptoms. In general, opioid medications are not recommended because they can lead to drug dependence and have significant side effects that may worsen pain over time. Physical and occupational therapy may also help to reduce the unwanted symptoms from fibromyalgia. Learning exercises and workplace adjustments that improve your strength and flexibility can help you to perform tasks in a way that will reduce the stress on your body. It can also be helpful to talk to a therapist or a counselor who can teach you effective strategies for managing stressful situations. Lastly, many people have found alternative medicine to be a safe and effective way to relieve stress, anxiety, and reduce pain from fibromyalgia. Examples of these treatments include acupuncture, massage therapy, and yoga. Acupuncture is an ancient form of Chinese medicine that involves the insertion of fine needles into the skin to various depths. These needles are thought to change blood flow and levels of neurotransmitters in the brain that help to relieve pain. Massage therapy is a form of integrative medicine that uses several techniques to manipulate muscle and soft tissue. The benefits include stress reduction, an increase in circulation, and improved immunity. If you think you may suffer from fibromyalgia, please know that you are not alone and you have many options for treatment. Reach out to your doctor to get started today. Do you suffer from fibromyalgia? Share your experience with us in the comments below. If you like this video, give it a thumbs up. To learn more interesting facts about the human body, subscribe to the channel. Here are 2 more videos that you should check out to learn more about your health.